not going too well. I just found out that my cousin got diagnosed with type 2 diabetes.
Oh, I'm sorry to hear that. Type 2 diabetes, it's not a great disease to have, but fortunately it's the most common form of diabetes, so it's pretty treatable.
Oh.
Would it make you feel better to know like more what's going on in his body? Would that
Yeah.
help? Okay, so for a person with, for a healthy person without type 2 diabetes, usually when food is digested in the body, it's broken down into molecules that we can use in the small intestine. And the most important molecule is going to be glucose. So glucose is what our body uses to make energy in the cells. So for a healthy person, the glucose gets from their small intestine into their bloodstream and transported to the cells, but it can't get in without the help of this hormone insulin, which is made in the pancreas.
Okay.
So for a normal person, the insulin comes and binds, which allows glucose channels to open, and that way the glucose can get into the cell. But for someone with type 2 diabetes, it's not working, the insulin isn't working correctly. So the glucose is still in the bloodstream. Their pancreas usually is producing insulin, not always enough. Sometimes it's not the right kind. And so when it gets to the cells, some of them have become insulin resistant, which means when the insulin comes and binds, either it's not doing its job properly or the cells themselves aren't responding in the right way. So even when the insulin comes, the glucose channels aren't opening correctly and the glucose isn't getting into the cell, which means that the body can't produce energy and it's not working quite the same way. So when this happens, a whole bunch of glucose builds up in the bloodstream and in the extracellular space, which can cause all sorts of problems, like for people who do have type 2 diabetes, they get this buildup and it can be secreted. The body tries to get rid of it through urination, which is why sometimes people with type 2 diabetes, they urinate a lot and they feel really thirsty. In addition to that, because the cells aren't getting any glucose, they're not able to produce any energy, which is why people with type 2 diabetes can feel tired and more lethargic.
Okay, so then why would my cousin have to take insulin shots if his body is like insulin resistant?
Yeah, so for people with type 2 diabetes, even if their cells are insulin resistant, they have multiple insulin receptors on their cells. So some of them could be insulin resistant, all of them could be insulin resistant. In that case, a different method of treatment is used. But since there's multiple, some of them are still usually functioning. So a little bit of glucose is allowed into the cell, but not enough for the body's needs. So that's why people with type 2 diabetes take the insulin shots so that their body can get all the extra insulin.
Okay, so if you like didn't take the insulin shots, like what would happen to him?
It wouldn't be good. So the body isn't made to have all that glucose just sitting around. So this could cause damage to the blood vessels. If the blood vessels are small and they're supplying blood to the organ systems, this can cause things like vision loss and nerve damage and all sorts of things like that. And if the blood vessels are bigger, this can even cause cardiovascular disease, stroke, or just a lack of blood circulation in general. So it's important to take the insulin.
Thank you for explaining that to me. That makes me feel a lot better.
Well, I'm sure your cousin is going to keep going on with his life.
Okay.
Just about.
Good.
All right.
Thanks, Kate.
Yeah, of course.